Diabetes can affect many parts of our body, including our skin. Some skin changes are seen in the later stages of diabetes, but some changes are early indicators of diabetes. In fact, skin problems are sometimes the first sign that a person has diabetes. Few skin lesions are typically seen in diabetes, but some skin changes are general and anyone can have them. But people with diabetes get them more easily. So let's discuss the signs one by one. Have you ever noticed a dark patch or a Acanthosis nigricans band of velvety skin on the back of your neck? Not only on the neck, it can be seen in armpit and groin areas. It is commonly seen in obese people. The medical term for this condition is Acanthosis nigricans, and it is a sign of high blood glucose levels. It may be the first sign that someone has diabetes. If you notice this type of skin changes, then consult your doctor. Early detection of diabetes can prevent many future complications. Next important feature is skin tags. Many people have a few skin tags or skin growths, and that is normal and harmless. But as you can see in this image, this type of numerous skin tags with blackish discoloration of the skin could be a sign of high blood glucose levels. These growths are most common on the eyelids, neck, armpits, and the groin region. You can see yellow, reddish, or brown Necrobiosis lipoidica patches on your skin. This skin condition often begins as small, raised solid bumps that look like pimples. As it progresses, these bumps turn into patches of swollen and hard skin. The patches can be yellow, reddish, or brown. You may also notice that the surrounding skin has a shiny porcelain-like appearance. You can also see blood vessels. The skin is itchy and painful. The skin disease goes through cycles where it is active, inactive, and then active again. The medical name for this condition is Necrobiosis lipoidica. If you see this type of skin lesion, then get tested for diabetes. The next important change is skin thickening or digital sclerosis. About 1/3 of people with type 1 diabetes have digital sclerosis, a thick, tight, waxy skin that develops on the back of the hands. The finger joints stiffen and become difficult to move. Sometimes this skin problem occurs on the toes and forehead as well. And rarely knees, ankles, or elbows may stiffen. Control of blood glucose levels and physical therapy may be helpful in this situation. You can use moisturizer to soften the skin. Diabetic dermopathy is a skin condition that causes spots that create a barely noticeable depression in the skin. It's common in people who have diabetes. The medical name is diabetic dermopathy, and it usually forms on the shins. In rare cases, you will see it on the arms, thighs, trunk, or other areas of the body. The spots don't cause any symptoms. For these reasons, many people mistake them for age spots. Unlike age spots, these spots and lines usually start to fade after 18 to 24 months. Diabetic dermopathy can also stay on the skin indefinitely. Bullosis diabeticorum is rare, but people with diabetes can see blisters suddenly appearing on their skin. You may see a large blister, a group of blisters, or both. The blisters tend to form on the hands, feet, legs, or forearms, and look like the blisters that appear after a serious burn. Unlike the blisters that develop after a burn, these blisters are not painful. Eruptive xanthomatosis is commonly seen in uncontrolled diabetes. When these bumps appear, they often look like pimples. Unlike pimples, they soon develop a yellowish color. You will usually find these bumps on the buttocks, thighs, crooks of the elbow, or the backs of the knees. They can form anywhere though. No matter where they form, they are usually tender and itchy. These yellow bumps disappear promptly when diabetes is well controlled. People who have diabetes tend to get frequent skin infections, which could be bacterial or fungal. Bacterial infections commonly seen in diabetes include styes, an infection of the glands of the eyelid. folliculitis, an infection of the hair follicle, and carbuncles, deep infections of the skin and the tissue underneath. Fungal infection is also very common in diabetes and is most commonly seen in warm, moist folds of the skin, like under the breast, around the genitals, between the fingers and toes, corners of the mouth, armpits, and the groin region. Common fungal infections include jock itch, athlete's foot, ringworm, and vaginal infections that cause itching. Having high blood sugar for a long time can lead to poor circulation and nerve damage. You may have developed this if you have uncontrolled diabetes for a long time, which may result in open sores and wounds that are hard to heal, especially on the feet. These open wounds are called diabetic ulcers. If you have diabetes, you should check your feet every day for sores and open wounds. Itching, localized itching, is often caused by diabetes and can be caused by yeast infection, dry skin, or poor circulation. When poor circulation is the cause of itching, the itchiest area may be the lower parts of the legs. You may be able to treat itching yourself by limiting how often you bathe, particularly when the humidity is low, using mild soap with moisturizer, and applying skin cream after bathing. So to conclude, if you notice one or more of the above-mentioned signs, it's important that you correlate them with other risk factors like obesity, family history of diabetes, or having a sedentary lifestyle. Just having only one sign cannot be directly linked to diabetes. It can be associated with other diseases as well. But if you're 40 plus and fall into this high-risk group, then it's better to check blood sugar levels on a regular basis. Early detection of diabetes and precautionary measures can prevent many future complications. And if you want to get rid of this high blood sugar problem, we have a 100% natural solution in the link in the description and in the first pinned comment. Put an end to this problem today. Alright, that's all for today. Hope you liked this video. Don't forget to like, share, and subscribe to our channel. Thank you.